You know, getting an ALS diagnosis is, well, it's a massive, life-altering moment. But right in the middle of that challenge, there's a really powerful way of thinking about care that's all about living better every single day. Today, we're going to dig into what that approach, palliative care, is really all about.
And this really is the central question that changes everything. It's about shifting the whole focus from just a battle against a disease to a strategy for maximizing your quality of life, your comfort, and your dignity, starting from day one. Okay, let's get the biggest misconception out of the way right now. Palliative care is not hospice. It's not. Palliative care starts right when you get a diagnosis, and it works with your main treatments like riluzole to manage symptoms and just make life better. Hospice, that's for the final phase of an illness, when curative treatments have stopped. Honestly, the best way to think about it is as an extra layer of support that's there for the entire journey.
So, here's our game plan for today. We're going to start with what this care really is. Then we'll get into how it helps with physical symptoms, how it supports you emotionally, how it empowers you through planning, and finally, we'll look at the actual proof of the impact it makes.
First up, this is about more than just medicine. Think of it like getting a co-pilot for your ALS journey. So here's the bottom line. Palliative care is a specialized field of medicine, and its goal isn't just to treat the disease, but to treat the person who is living with the disease. It's all about easing suffering and making each day the best it can be. It works alongside your primary ALS treatments, it doesn't replace them.
And look, this isn't a one-person show. It's a whole crew, your co-pilot team. You've got doctors and nurses, sure, but also social workers, therapists, speech pathologists, even chaplains and dietitians. They all work together to help you navigate pretty much every challenge ALS throws at you, physical, emotional, and practical.
Okay, next up, let's look at how this team actually helps ease that physical burden by taking a whole-person approach to managing symptoms.
Pain is a huge deal. It affects up to 70% of people with ALS, but the thing is, it's manageable. The team basically comes at it from two sides. They use medications like baclofen for stiffness, but they also combine that with things like physical therapy and positioning aids. It's all about providing total comfort.
Now, respiratory health is absolutely critical. It's the leading cause of death in ALS. So the palliative approach here is proactive, not reactive. The team keeps a close eye on lung function, and if it drops below 50%, they bring in non-invasive ventilation like a BiPAP machine. It sounds simple, but that one step can seriously improve sleep and even extend survival by months.
And think about this. Swallowing difficulties affect up to 85% of patients. That creates a risk for things like malnutrition and pneumonia. So the team, including speech-language pathologists, gets right on it. They might suggest changing food textures. But, and this is so important, if a patient loses more than 10% of their body weight, they'll start talking about a peg feeding tube early on. That helps stabilize nutrition and takes a huge amount of stress off of mealtimes.
So, we've talked about the body, but what about the heart and the mind? That's what we're diving into now, looking at how to support both patients and their families.
The emotional weight of ALS is just immense. We see about a third of patients dealing with depression, and anxiety is incredibly common. The palliative team is actively looking for this kind of distress so they can provide that psychological and emotional support right away.
And it's not just about the person with ALS. What about their family, their caregivers? This number really says it all. A staggering 40% of ALS caregivers experience burnout. This journey belongs to the whole family, and palliative care absolutely recognizes that.
So what does this circle of support actually look like in practice? Well, it's everything from counseling for both the patient and the family to connecting them with support groups. It's arranging for respite care to give caregivers a much-needed break, and even helping them navigate the crazy financial maze to get the right equipment.
All right, this brings us to a part of the process that is so important, honoring your wishes by empowering you through planning.
Now, advanced care planning, I know, it sounds a little scary, right? But it's really all about empowerment. It's not some single, grim conversation. It's an ongoing dialogue that starts right from the beginning to make sure that your values, what truly matters most to you, are the North Star for every single medical decision down the line.
So this covers the big stuff, for sure. Your thoughts on interventions like feeding tubes or ventilation, where you'd prefer to be for end-of-life care, and making sure it's all written down. But it also covers some really beautiful, deeply human stuff, like legacy projects, helping you record your story in your own words for your family.
Okay, so for our last section, let's talk about the proof, the hard data. Why do we know this approach is such a lifeline?
Because it works. I mean, look at this. Studies show that patients who get palliative care early in their journey live, on average, 10 months longer. That is nearly a full year of more time, more memories, more life.
And it's not just about living longer, it's about living better and staying out of crisis mode. Bringing in palliative care cuts down on emergency room visits and hospital stays by a full 30%. That means more stability and more time at home, which is where pretty much everyone wants to be.
But honestly, this might be the most important number we talk about today. On average, patients report a 25% improvement in their quality of life scores. They feel better, they feel more supported, and they feel more in control. And at the end of the day, isn't that the whole point of care?
So when you put it all together, it really leaves you with one big question, doesn't it? When you see evidence this strong, a longer life, a better quality of life, less time in the hospital, and more empowered patients and families, it just makes you wonder, shouldn't this kind of holistic, person-first approach be the standard of care for everyone facing a serious illness?